Hello, this is the first in a series of mandatory trainings developed by your school nurses. My name is Kathy Law, and I will be presenting anaphylaxis. At the end of this training, staff will be able to react to an allergic anaphylactic reaction. You'll be able to recognize the signs and symptoms of anaphylaxis, administer an EpiPen, activate the EMS system, know what information needs to be conveyed, and understand that anaphylaxis is a life-threatening emergency. The big takeaway is you need to act swiftly. We will also discuss how to keep children with life-threatening allergies safe while they are in school and during the COVID pandemic. To complete this training, staff will need to demonstrate the administration of an EpiPen, which your school nurse will coordinate when students return to school. EpiPens are an approved delegated medication that can be administered by a non-medical person in the absence of the school nurse. This particularly applies to all teachers and staff who work in before and after school programs and attend scheduled field trips. So what is anaphylaxis? Anaphylaxis is a serious life-threatening allergic reaction. The most common anaphylactic reactions are to foods, insect bites, medications, and latex. If someone with an allergy tastes, eats, inhales, or touches the allergen, the immune system overreacts by releasing chemicals that cause allergy symptoms. Typically, allergy symptoms are localized, such as redness, swelling, or hives, but some people are susceptible to a more serious anaphylactic reaction affecting more than one part of the body at the same time. Certain people are more at risk for anaphylaxis. Those that have allergies and asthma, have a family history of anaphylaxis, or have experienced anaphylaxis in the past. Anaphylaxis by the numbers. 8% of the pediatric population is affected by food allergies. From 1997 to 2001, food allergies among children increased 50%. It's said that about 2 million EpiPens are prescribed annually. 8 major food groups account for 80 to 90% of all allergies. That's peanuts, tree nuts, milk, eggs, soy, wheat, shellfish, and finfish. These are by far the most common triggers of anaphylaxis in the pediatric population. 1 in 25 students have a food allergy, so in today's classroom, a teacher can expect at least one student will have a life-threatening food allergy. 29% of children with food allergies have asthma, and 25% of food allergies occur without a previous diagnosis. Teens and young adults are at greatest risk of fatal reactions because they frequently eat away from home, don't carry their EpiPens, ignore or deny symptoms, drugs and alcohol may be involved, and let's not forget about kissing. Contact with someone who has just eaten an allergen can trigger a reaction. The first step in managing anaphylaxis is recognizing symptoms. I want to emphasize each person's symptoms are unique and each reaction is unique. Please take a few minutes to review the symptoms and what a student may say. The reaction could be mild one time and life-threatening the next. Some allergic reactions can be severe at onset or can progress from mild symptoms into a more severe reaction or anaphylactic shock. So what happens during anaphylaxis? Since the reaction involves the whole body, the student may get a sense that something is happening before any visible symptoms show up. He or she may feel anxious, like something is wrong, but not quite sure what it is. A rapid heart rate may accompany this feeling, contributing to an overall sense of anxiety. Often the first visible symptom appears on the skin, which gets red. This can occur on the cheeks, chest, neck, or any other area of the body. Swelling of the eyes, lips, hands, feet, or other areas may swell up rapidly. While the body is swelling, there may be sneezing, runny nose, nasal congestion, the tongue may swell, and the throat and chest may tighten, which can cause coughing, trouble breathing, trouble swallowing, and wheezing. GI symptoms such as cramps, nausea, diarrhea, or vomiting are common with food allergies. There could be a drop in blood pressure followed by dizziness and a fast heart rate. This is related to the way the heart and blood vessels function during anaphylaxis. If this occurs, lie the student down and elevate the legs. You can imagine how stressful it is when an EpiPen is needed. So it's important to have a plan of action so you can react calmly. Knowing when to use EpiPen is easy if the child has hives, wheezing, or swelling, but sometimes the signs are not so obvious. So when in doubt, give the EpiPen. Epinephrine is very safe. You may not know what the child has eaten, but if you suspect an allergic reaction, don't wait for symptoms to develop. The longer you wait to give the EpiPen, the harder it is to stop the allergic reaction, and a reaction can change from mild to fatal symptoms quickly. Now we'll watch a short video on how to administer an EpiPen.
A life-threatening allergic reaction, anaphylaxis, is unpredictable. It could be mild 1 minute, then suddenly
it's scary, like you can't even breathe scary.
Or your skin gets all itchy and breaks out into hives scary.
Or your throat starts to tickle and close scary. It's different for everybody.
Every reaction is different. A mild reaction one time can be life-threatening the next. So it's important to know your body and know when it starts to feel funny. It could be the warning signs of anaphylaxis.
So it's also important to know how to use one of these.
An EpiPen auto-injector.
The EpiPen and EpiPen Junior are for the emergency treatment of life-threatening allergic reactions.
And for people who are at an increased risk for these reactions.
EpiPen and EpiPen Junior should only be used to help someone during an emergency.
Ready to show them how it's done?
Yeah,
EpiPen Junior, the one with the green label, is for kids.
like me.
An EpiPen with the yellow label for bigger people, like me.
Whether you need to use EpiPen on yourself or give it to someone else, you can just follow these simple steps. So first things first, you take it out of the tube.
Just flip open the yellow cap,
Or the green cap.
slide it out, and hold it like this. Blue to the sky,
Orange to the thigh.
then you take off the blue cap.
Blue safety release.
Never put your hands near the orange tip because that's where the needle comes out.
The needle is designed to go through clothing, including jeans, because it must be injected into the outer thigh for quick absorption. If you're helping a young child,
Like me.
hold the leg firmly in place. Once it is,
You just do this. Boom.
it clicks, so you know it worked. Then you hold it there for 3 seconds.
Then, remove EpiPen.
You'll still see some liquid in there, but don't worry, your EpiPen Junior auto-injector gave you the right dose, and it has a special feature, the never see needle.
Yeah, so the needle's totally covered up.
So you should never see the needle.
Then rub the spot for 10 seconds while you or someone else gets emergency medical help right away.
Call the ambulance.
Or
Just a few comments. The side effects of epinephrine include pallor, tremor, anxiety, and palpitations. The side effects usually go away quickly if the student lies down and rests. As stated, the epinephrine can be given through the clothing. Avoid obstructing seams or items in the pockets, and everyone should know where the EpiPens are kept at their school. Ask your nurse. They are usually kept up in an unlocked location in the health office. I want to point out 3 different brands of epinephrine that you could possibly see. All brands contain epinephrine. All 3 brands are administered in the same way. The only difference is the packaging and how the pen is activated. The original brand, which is named EpiPen, was used in the video. The generic brand comes in the same 2 doses as the EpiPen. This is more pen-like, comes in an opaque case that you twist off the top and the bottom, slide the pen out. You may need to remove the caps from both ends. As you remove the bottom cap, you will see a red warning sign telling you the needle is live and ready. The AviQ comes in 3 doses and provides electronic voice instructions as soon as you remove the device from the case. It will instruct you to remove the red safety guard, plunge it into the thigh, hold in 5 seconds, and remove the injection. If the electronic voice is not working, it is okay to use the EpiPen. The final step is to activate the EMS system and call 911. State the student's name and age. State he or she had a severe allergic reaction and received EpiPen. State the triggers if known, state the time the EpiPen was given, and request the EMS to bring a second EpiPen. Immediately after treatment, the student needs to be assessed in the emergency department to determine whether additional interventions are needed. One intervention may be the administration of a subsequent dose of epinephrine due to the recurrence of initial symptoms after they have resolved and despite no further exposure to the trigger. This is called a biphasic reaction. The second dose can only be administered by a licensed medical professional. The reasons we ask EMS to bring a second EpiPen is twofold. Students may not have two EpiPens. Parents will frequently split the pack and send one pen to school and keep the second pen at home. And not all ambulances carry an EpiPen. Once you've treated the student, then you'll call the parent and tell them to meet the ambulance at Hospital X. Stay with the student until EMS arrives. Position the student however they are most comfortable, sitting or lying down. So how can we keep children safe while they are at school? I'm going to provide you with some examples of best practices. The nurse prepares the emergency action plan, or it's called an EAP. This is documented for unlicensed personnel. It alerts teachers, staff, subs, and itinerant staff to the student's allergy, and it provides instructions during an emergency. It needs to be accessible to everyone who interfaces with the student in the classroom. The school nurse will work with the family and the physician to obtain an order and detailed history. We want to know exactly what this child is allergic to, when did the reaction occur, how recent was the last reaction, does the patient say anything when they have a reaction, and how sensitive is the child when they are exposed to the allergen. Do they have to ingest the allergen, or does the skin contact trigger a reaction? This is the sample here of an emergency action plan. You can see the medical diagnosis is food allergy to peanuts, tree nuts, wheat, eggs, and milk. The patient's pertinent information is a student has asthma and a family history of anaphylaxis. So those are two risk factors that place the student at risk. The student has never had an anaphylactic reaction, but recent allergy test results indicate high sensitivity to the allergens. So that places her at risk also. And don't get tripped up if somebody has never had an anaphylactic reaction. It doesn't mean that it can't happen. I have added this screen to remind us that Benadryl is not delegated to non-medical staff. In a severe food allergy reaction, the median time of exposure to respiratory or cardiac arrest is approximately 30 minutes. Benadryl reaches its peak effect in 1 hour. Epinephrine takes effect almost immediately, and Benadryl will not stop anaphylaxis. In the context of treating and preventing a severe reaction, like Benadryl, the same holds true for asthma inhaler or the administration of a second EpiPen. Benadryl, asthma inhaler, and the second EpiPen are not delegated to non-medical staff. School nurse will assess how well the student can advocate for themselves. We want to know if they understand what their signs and symptoms are. Do they know not to share food? Do they know to notify an adult if they think they may have been exposed to an allergen or if something feels wrong? How are they going to, do they know what their avoidance strategies are if they come in contact with an allergen? Do they know not to keep their hands away from their mouth, nose, or eyes? Hand washing with soap and water versus hand sanitizer. Unlike with the COVID, hand sanitizer does not break down peanut protein, so they have to wash their hands with soap and water. And do they know to report any food bullying? Food service in school will be different during COVID. Our current guidance from CDC and DESE is for students to eat in their classrooms with their cohorts. This can be safely done, but will require additional training for teachers and staff. One best practice is to clearly label tables for those eating foods containing allergens. This contains the allergens to a particular area. Students with allergies know not to sit at these desks or tables, and it cuts down on the desks and tables that need to be washed. It's opposite of the allergy aware table in our cafeterias. This is just a sign you could place for the lower school at the allergy table so they know these are the foods. If they're eating these foods, they should be sitting here. And this is one for the upper schools, reminding the students to wash their hands after their meals and to clean the table thoroughly. Another best practice is to clean desks and tables with disposable paper towels. When we use reusable cloths, there is a risk of cross-contamination from one surface to the other. The allergen tables should be cleaned a second time by a teacher, and students with food allergies should never clean any desk or table other than their own. This is an example of a small sign you can post in the classroom with common symptoms and steps to take in the case of an allergic emergency. It can be posted or it can be kept with your emergency action plans. This is a small laminated card that the instructional coach at West Tatnick made for teachers and staff to carry during lunch duty. It has the student's name, grade, and allergy. Therefore, everybody knows which students sit at the allergy aware table. I want to go over some specifics of the Worcester Public School protocol. All classrooms will be allergy aware. If nut or peanut containing products are brought into the classroom, desks will be washed and the student will wash hands. All school cafeterias will have a designated allergy-free table. Letters will be sent home to parents requesting their cooperation in maintaining an allergy-aware classroom. All students will wash their hands after lunchtime and before returning to the classroom. Cafeteria staff will be provided with a list of those students with serious food allergies. Teaching staff are asked to consider food allergies when preparing lesson plans that use or discuss food. If any food-based activities occur in the classroom, all desks will be washed with soap and water and dried with a paper towel. Teachers will remind parents to send in safe snacks for special events. Many schools have eliminated celebrations with food. Home-baked goods are discouraged, and if food is brought in, the ingredient label should be intact and context reviewed by the parent. The same holds true for projects that use food. The school nurse must be notified 2 weeks in advance of any scheduled field trips, so proper precaution and education are in place for the event. And only the school nurse can administer epinephrine in the case of an undiagnosed allergic reaction. This concludes our training. For questions, please see your school nurse. Thank you.